Now, a year ago, these guys and myself got together on Zoom. We had never met before. We were five strangers. There's one missing. He's going to arrive later, Dr. Trim. And we decided that it was time to disrupt the status quo when it comes to healthcare and wellness. And today we're going to spend a little bit of time getting to know each other. Actually, we've been working together for several months. Today is the first time that we meet live our own Chief Technology Officer. So that's the world we live in now. We can be extremely friends, great partners, and yet we've never met live before. And we worked really, really hard over the last few months. So I'm going to ask each of you to introduce yourself. I'm going to start with myself. I'm Helene Blanchette. I'm former Global Vice President of Xerox. So I was in the business side. I'm the business mind and marketing mind. And I'm thrilled to be part of this great diversity team that is there to disrupt the way we do things. We went with the idea to say, we're going to bring healthcare and wellness into the metaverse, creating a medical metaverse, and we should start from a blank slate instead of trying to mimic what is already there. And to say, if we go with a blank slate and we let the patients, the consumers, the medical people, the medical staff that has gone through so much over the pandemic, if we let them talk and let them express what it should be, what would it be? And this is what MDDAO is all about. It is to hear the voice of everybody, to be able to translate that into a medical metaverse. So I'm going to start with Nick. Would you like to introduce yourself? And what is a Chief Technology Officer of an MDDAO?
Sure. So my name is Nick Donarski. I've been in technology and really cybersecurity for 22 years. Professional hacker by trade, and build and break things. And really the goal for us, right, with MDDAO is building on a solid foundation focused on security, right? Security is the foremost fundamental thing that anybody in technology needs to focus on, because anybody and anything that you build, somebody's trying to either take from you or get access to. So building with the foundation of security and promoting the bleeding edge thoughts of really what is metaverse, what are medical rewards, what is crypto, and how does that all play into the medical space is a big thing. So that's my background.
Thank you, Nick. And Nick is
this is the first time we actually met. And
Yes.
And then usually we see him in the basement where hackers are, in a bunker.
Like a real hacker,
so it's
right?
very impressive.
Yeah.
He looks younger.
And we also have with us Dr. Stephen Tang, the pediatrician. Dr. Stephen Tang, please introduce yourself.
Hi. So I'm a pediatrician. I've been in practice for about 30 years, both in academic medicine as well as community medicine and private practice. And so my main goal and my main focus here is really to try to change our focus for healthcare and reverse the current paradigm. Currently, healthcare is more like top-down. You have your executives, you have your hospitals, you have your doctors, and on the bottom, they're just us healthcare consumers. I want to flip it around where the healthcare consumer is actually number one and most important aspect of the care continuum. And I want to incentivize them to actually be more activated and more of a healthcare partner.
Thank you. And of course, our CEO, Arabian Prince. Arabian.
Yeah, so how I got involved in this was kind of interesting. One of our business partners, Gary, who's not here today, came to me and said, hey, we want to do something medical, and we want to do something medical in the metaverse. And I'm like, okay. And a little more of my background, I've been in the tech space for about 41 years. And I said, I can help with that. I can put something together. So, met with Gary, met with some of the team, and we decided to partner and put together this amazing platform. And for me, like Nick said earlier, it's about healthcare, safety, security, and for me, it's about access, giving access not only to everyone else, but giving access to a lot of people who don't have access to good healthcare. So if we can put it on your phone on your computer, where you don't always have to go to the hospital. Like every time you go to the hospital and be with your doctor, how long do you, doctor, tell me, doctor, how long do people actually meet with you when they come in?
So there's studies out there, and actually, on the average, you actually have face-to-face contact with your doctor for around 5 to 7 minutes per visit. So most of it's actually busy work. When you see your doctor, oftentimes he doesn't even look at you in the eye. He has a sort of chart, and he asks questions, and then a lot of that is not personal care. So we really want to be able to offload some of that to either the metaverse or to AI, and then that way it gives you more personal time with your doctor, and it's more satisfying as a physician also that you have to have like more face-to-face contact.
Yeah, and getting back to that, 5 to 7 minutes with your doctor, but how often or how long are you actually in a hospital waiting to see your doctor? Even there an hour or 2 hours. So we're trying to change that and make it so that you only need to go to the hospital when you actually need to go to the hospital, God forbid. So yeah.